Howdy, hi, hello, welcome back. So we are going to now be talking about the stages of group counseling. Now there are several different people who have come up with different stages. Some names, this is the Tuckman model, there's also the Corey model, and there's also Yalom's model. But a majority of them follow the same course, they just have semi-different names. So I'm just gonna go through the OG, which is this one, right? The forming, storming, norming, performing, and adjourning model. And I like this one the best because it has similar sounding names that makes it easier for me to remember. Let's go through the timeline of how this is gonna look. So some questions that I've gotten on this before are like, the group is currently working at their best capacity. They are doing everything well. What stage are they in? And then they'll give you the options. They would be at the performing stage because they're performing their best, they're doing the most, they are effective, they're working together, all that good stuff. But let's go over the other stages. So I guess I'll keep this. Starting with the forming stage. So at the forming stage, you are forming your group together. That is going to cause some tension and anxiety because these are people that you've never met before in your life. How would you feel if you just went to a random place and sat down? You're trying to figure out who everyone is. You're trying to put on your best self. You are just not 100% comfortable. So there's not a lot of effectiveness happening here because nobody knows each other. And this is where the therapist is playing therapist and trying her best or his best to get everybody to work together and come together and feel safe. That's for forming because you're forming the group. Another thing on like the therapist perspective is you should be screening. So you should be screening who gets to come into the group, and as well as sharing all of the rules of the group. So one of the big ones is confidentiality. Another thing I've seen with confidentiality questions asked is like, can confidentiality be 100% guaranteed in group therapy? Yes or no, or true or false? No, it can never be 100% achieved because you have ideally a group of 8 who is working together, and you can't guarantee that all 8 of those people will never share anything that they learn in the group or that they say in the group. However, you should make it explicitly clear at the beginning of a session that confidentiality isn't guaranteed, but everybody should strive to keep what they say and what is heard confidential. The next one we have is storming. During the storming process, you figure out who you don't like and who you do like, that you don't agree with what this person said and that you did agree with what this person said. You start to form subgroups, you start to bicker a little bit. There's a lot of tension. So the teamwork will discover more difficulty than they expected. In this stage, you're going to have anxiety, conflict, you're going to have resistance from clients, you're going to have your leadership being challenged, you're going to have questioning as to like, why is this helping us? And the leader should create a supportive, trusting environment. They should address anxiety and resistance, provide being a role model for them, keeping group goals in focus, and support, but also challenge group members if they don't want to share. So that's the storming. And then once we get past the storming, we get to the norming. So this is the normal for the group. We're at a good spot here. So here we start to respect each other's differences, what we bring to the table, and just getting along. At this point, the group leader should be doing less work, the group leader being the therapist, and the group itself learning how to talk without needing that guidance. And then once we move past that stage, we go into the performing stage. So this is, we are at our best. We are performing the best we possibly can. We are highly functioning. I wouldn't say don't need a therapist, but we can converse on ourselves. The therapist is doing the minimal work. You are now very efficient, as well as you're more focused on the here and now. The group members help each other through their issues. They're feeling comfortable. Leader is providing reinforcement, they're linking each other, they're supporting risk, they promote appropriate behavior, they encourage translating insight into action. That's our performing. And lastly, we have adjourning or mourning. So this is when the group must come to an end. All good things must come to an end. So group session depending on where and what it is for, will usually last a few weeks. Now, during the adjourning phase, you've already worked through a majority of the things that you're supposed to work through. Because of this, you are ready to depart from the group, or the group is coming to an end. Now, of course, if you spend 2 hours every week for, let's say, 8 weeks, you have a grown attachment to the group members. And because of this, the group members will start to experience sadness. They'll start feeling like, oh my gosh, what am I going to do now that I don't have this group? Feelings of unfinished business, feedback, preparing for the outside world, decisions about what course to take. So leaders should deal with those feelings, reinforce change, help members make plans and contracts, assist members to understand and integrate what it is that they learned in the group. Confidentiality continues post-group. Just because the group ends doesn't mean the members can start talking about what happened in the group. And then, if possible, schedule like evaluations for post-up later on if they need to come back. Like, always make yourself available in that sense. Like, if you are still struggling with this issue, feel free to come back and we can continue working, type of thing. Those are the stages of group counseling. Yay. Next, I guess we'll talk about the leadership styles, since I didn't finish. This is such a long video already.